Hello, my name is Rosiel Abreu, and this is a video for the English Language Laboratory. Today we're going to talk about personal care and healthcare. That is a subject that is very important for everybody. So that is something that affects all of us because we all want to be in a healthy state and we all want to look good from the outside and the inside too. So this is a subject that I think is very important because for everybody, nothing could be more important than their health. We specifically, um, we are like depending of our health for to do everything. For example, if I'm not healthy, I can't go to work, I can't study, I can't do the things that I do in my daily life, you know. So that is a thing that is very important and should be very important for all of us. But there is a thing that not everyone can experience that thing in the same way because not everyone has the access to good healthcare or self-care, and also that something that is simple that can be our daily routine is not too simple for everybody because not everybody has the access, has the resources to help themselves in that way. For example, a person that works in a job with a low salary can't afford some things that most people can. For example, they can afford to have a diet or go to a nutritionist to tell them you have to eat this kind of thing or that kind of thing. They can go to the gym to do exercises for the body, but there is always, I think, a way to make that thing to happen. For example, if I can't go to the gym, I can do the exercises in my house. In YouTube, we have a lot of videos and channels that shows us how to do the exercises, depending of the goals that we had with our bodies. So there is always a way, but that doesn't mean that it's easier for those peoples because it's I think it's something very that has a lot of phases on it. So, for example, in my experience, I would like to have a better daily routine, a better self care and health. But as I don't have a permanent job, I work some days in the week because I have a little business of desserts. So I don't have the enough resources to, for example, go to the gym or have a specific diet or buy some products for my face or for my body. But I can always do what is affordable for me. What I can do, for example, is eat the chicken grilled instead of fried, or eat boiled eggs instead of fried eggs. And for example, some things that are not good for our health, we can avoid that. For example, all those fries or the fast food that we all know is not good for our health, but is sometimes is affordable and is delicious. I have to say, but it's not good for our health. So with the money that you use to buy, for example, a hamburger with fries, you can use it to buy some vegetable and some eggs and some chicken um, as I could say, and you can eat more healthy. So, in the case of personal care, we should start talking about our morning routines and how everybody has a different morning routine. For example, some people start their day drinking like a smoothie made from fresh vegetable, from, for example, and fruits too. For example, apple or cucumber and things like that. But some people decide to just drink a coffee, and we have to think what is more, what is better for my body? What does the real good in my body? A coffee or a smoothie with ingredients that are good for me, that give me energy, that give me health. And for example, some people in the mornings do a gym session, or and some things decide, and some people, excuse me, decide to stay like in their bed the whole morning. You don't have to go to the gym, as I said before, to do exercise. For example, in the morning, if you can't go to the gym, you can wake up and run or walk in the street. And I think it's a very excellent way to start our day, because when you do some exercise, you have more energy. You are more like wake. You can do everything like this fast. But when you start your day like lazy, and I don't want to wake up, I don't want to do things, to do things, this and that, is different. So that things are not good only for our health. I think they are good for our feelings too, how we feel, and how our day is going because of that. I think that is very difficult. I think is the healthcare access, because not everyone has the money to go, for example, to a doctor, and some people struggle with high medical cost of the drugs. And for example, some people avoid to go to the doctor because of their financial concerns. For example, I can have a headache for some days, but I think I don't have enough money to go to the doctor, so I will just drink a pill for that. And that can relieve you for some minutes, but if the problem is real, you will have it again. So some people avoid to go to the doctor for those reasons, and at the end of the day, they end with more problems, like they end more sick because of that. So it's something that is very difficult, because I can understand those people. Not everybody has the money to go to the doctor, and we know some public hospitals are not good. For example, in my country, in the Dominican Republic, and specifically where I live in Constanza, the public hospital is very bad, has a bad reputation, because the most of the people that go there doesn't end with good like results. And if you have a big trouble, you have to go outside of our town. You have to go to La Vega, to another public hospital. So if you have an emergency here, you have to go directly to a private hospital, and we know these are very very expensive. So not all the people can do that. So it's very hard be in that position, and I think a good healthcare access should be affordable for everybody, not only in the private way, but also in the public way, because the most people, I think, don't have the no resources to pay for that amounts of money in the private clinics. And I think we should talk also about a subject that is mental well-being and stress management that is just as important as our physical health, because self-care is more than just a diet and exercise. It's also about our mental health, and people with financial stability can afford therapy, can go to a psychology, but not everybody can do that. So it's very hard when a people need some mental care and doesn't have the enough resources to do that. I think that is a very hard subject, but we can always do things to try to make us feel better. And we also have some tools like videos in YouTube from or in another apps or social media that professionals can do some advices for us. So to finish, I think every subject that we speak about today is very important. Not only our physical health or our health care, our mental care, and our routine is everything important. For us to be good, we have to have all those things together and be in a good place in our life so we can make it happen. So I hope you like the video, and thank you.